Did you know that the global prevalence of autism spectrum disorder is on the rise? Autism spectrum disorder affects many children worldwide, with varying prevalence rates. In the US, it's 1 in 44, while in India, it's around 1 in 89. The term autism was coined in 1943 by Leo Kanner. Symptoms include social communication challenges, repetitive behaviors, and sensory sensitivities. Management involves behavioral therapies, educational interventions, and communication therapies. Personalized strategies focus on individual needs for independence and quality of life. Remember, early intervention is key for optimal outcomes. Let's spread awareness and support those with ASD. Diagnosing autism spectrum disorder (ASD) can be challenging due to its potential coexistence with conditions like attention deficit/hyperactivity disorder, ADHD, obsessive-compulsive disorder, OCD, anxiety, depression, or conduct disorder. Regardless of the specific diagnosis, effective management hinges on accurately targeting the underlying constitution. Signs of ASD can appear in infancy, such as reduced eye contact, non-response to names, or disinterest in caregivers. Some children may initially develop normally, but then unexpectedly withdraw, become aggressive, or lose previously acquired language skills, typically noticeable by age 2. Children with ASD exhibit a broad range of behaviors and severity levels, from low to high functioning. While some may face learning challenges and below-average intelligence, others might have average to above-average intelligence but struggle with communication, practical application of knowledge, and social adaptation. The severity of ASD is assessed based on the extent of impairments and their impact on daily functioning, which varies widely among children. Autism spectrum disorder, or ASD, encompasses a range of conditions marked by challenges in social interaction, communication, and repetitive behaviors. While the experiences and symptoms of autism vary widely among individuals, common issues include difficulties in sharing emotions, maintaining relationships, and interpreting nonverbal cues. Traditionally, the perception has been that there is no cure for autism. However, an evolving approach known as constitutional treatment is changing this narrative. By understanding and addressing the unique constitution of each child, considering their natural tendencies, sensitivities, and behaviors, significant improvements can be made. This method offers a hopeful perspective for managing ASD more effectively, enhancing emotional expression, and improving social interactions and behaviors. This video is designed to inform and educate everyone involved in autism care, from parents and families to educators and healthcare professionals, about the potential of constitutional medicine. It aims to provide insights into how this approach can transform the care and management of ASD, emphasizing tailored treatments that align with an individual's unique needs. We will delve into how constitutional treatment can shift the perspective from no cure to significant improvement, outlining its principles and integration into broader autism management strategies. Individuals with autism spectrum disorder, ASD, often encounter challenges in social communication and interaction, manifesting in behaviors such as unresponsiveness to their name or seeming not to hear at times, disinclination for physical contact, limited eye contact and minimal facial expressions, delays in speech development or regressions, difficulty initiating or maintaining conversations, atypical speech tones or rhythms, literal repetition of words or phrases without understanding their context, inability to understand straightforward questions or instructions, lack of emotional expression or recognition, non-use of gestures for pointing or sharing interests, inappropriate approaches to social interactions, trouble recognizing nonverbal cues. Individuals with autism spectrum disorder (ASD) may display restricted, repetitive behaviors and interests, including repetitive movements such as rocking, spinning, hand flapping, and other specific actions like repeated hand washing or pulling others' hair. Self-injurious behaviors like biting or headbanging, and aggressive actions such as pinching or kicking when challenged. Strict adherence to routines, with significant distress over minor changes. Coordination issues and unusual movement patterns, such as clumsiness or toe walking, often accompanied by exaggerated body language. Intense interest in specific object details, like the spinning wheels of a toy car, without understanding their overall function. Heightened or reduced sensitivity to sensory stimuli like light and sound, and varied responses to pain or temperature. Difficulties with concentration, especially in academic settings. Lack of engagement in pretend play. Intense fixations on specific objects or activities. Particular food preferences based on texture or type, and strong aversions to activities like hair or nail cutting. Others fastidious about nail cutting. Unusual fears of the dark, confined spaces, or certain animals. Signs of excessive hunger or difficulty swallowing solids. Destructive behavior such as tearing materials or leaves. Stubbornness, often not complying until personal demands are met. Although it is believed that there is no cure for autism spectrum disorder (ASD), I advocate for a treatment approach based on constitutional medicine, tailored to each individual. This method can significantly improve autism symptoms in children. Further details and examples will follow in this presentation. Typically, identifying the appropriate constitutional medicine is achievable in half to two-thirds of cases, and is complemented by standard supportive treatments. Early intervention, particularly during the preschool years, is crucial for developing social, communication, functional, and behavioral skills. Treatment options include behavior and communication therapies. These focus on social, language, and behavioral challenges, promoting social appropriateness and enhancing communication through methods like applied behavior analysis, ABA, which uses a reward system to encourage skill learning and application. Educational therapies. Structured programs involving a team of specialists focus on improving social skills, communication, and behavior, with intensive, personalized interventions in preschool yielding significant improvements. Family therapies. These provide training for family members to better interact with the child, manage behaviors, and teach daily living and communication skills. Other therapies, tailored to the child's specific needs. These may include speech, occupational, and physical therapy, along with psychological advice for managing behaviors. Medications are sometimes prescribed for managing specific symptoms associated with autism spectrum disorder, ASD, though none address the core symptoms of the disorder. It is essential to monitor interactions between these medications and any supplements to mitigate potential side effects. For managing hyperactivity in children, specific medications may be recommended. Antipsychotic drugs, primarily prescribed for conditions like schizophrenia and mania, are sometimes used to treat severe behavioral issues. Antidepressants might be prescribed to alleviate anxiety. While I am conscious of the potential side effects of these drugs, I typically avoid using them in children when constitutional medicine effectively manages the core issue. However, I occasionally consider medications to control seizures. Biomedical treatments for autism have been studied by James B. Adams, a professor at Arizona State University. He suggests that while these treatments may not benefit every child, they have significantly improved the conditions of thousands. The methods include dietary adjustments like eliminating sugar, chocolate, gluten, and casein, along with incorporating supplements such as vitamins, calcium, high doses of magnesium, and essential fatty acids. Other approaches involve the use of digestive enzymes with each meal, gut treatments with antifungal agents and probiotics, assessing amino acids, melatonin levels, and thyroid function, increasing plasma sulfate levels through sulfation, glutathione therapy, chelation to remove toxic metals, and regulating the immune system with intravenous immunoglobulins. These methods have produced mixed results and require considerable effort. Adhering to casein-free, chocolate-free, sugar-free, and gluten-free diets can be particularly challenging for children. Moreover, the protocols involving various enzymes, fatty acids, amino acids, sulfation, chelation, gut treatments, and intravenous immunoglobulins are complex, time-consuming, and financially burdensome. For me, the simplest approach is to identify the constitutional remedy and administer it. If this does not yield results, I would then consider exploring these more intricate treatments. Numerous uncertainties exist regarding autism, especially its exact causes. It is widely believed that genetic, biological, and environmental factors contribute to the condition. Although various supportive therapies are available, they often offer limited benefits and do not serve as definitive treatments, unlike the notable improvements seen with constitutional treatment. The effectiveness of biomedical therapies are variable. A definite reality is the existence of children suffering from autism, which also causes unimaginable suffering for parents and places a significant burden on them. I have observed an association with constitutional types. Notably, when a child's constitutional type is identified, recovery tends to be more definite and quicker. The most common type I have encountered is associated with natrum muriaticum, or the salt constitution, often indicated by a clinical sign of black discoloration around the nails. Based on my personal observations and limited experience in treating a few patients, I believe that a potential cure for autism might be achievable if the child's constitutional type is clearly understood. I plan to provide concrete figures and results in a couple of years. Stay tuned and subscribe to my channel Trying Curable to follow some of the autism cases I've treated and to learn more about the outcomes of this ever-increasing challenge known as autism and its spectrum, ASD. Watch for the upcoming video series Autism Can Be Cured Part 2.
I am Dr. Sudhakar Reddy Tirupthi, specializing as a pediatrician and holistic practitioner with a focus on spiritual medicine named homeopathy. I extend a warm invitation for you to explore and subscribe to my channel, Trying Curable. Here, you'll uncover a treasure trove of unique and insightful health-related content that transcends traditional approaches. My channel is a source of invaluable information with the potential to significantly impact your life positively. Should you be inclined towards a holistic view of health, I urge you to subscribe to Trying Curable and share this resource with your network. I deeply value your time and interest in my approach to holistic health, and I sincerely thank you for it.